Good afternoon, good morning, or good evening, depending on where you're tuning in from, students, STEM educators, and all those who are interested in the STEM industries. I am so excited to welcome you. As you know, my name is Lewis, and I'm here supporting the BoSTEM initiative at United Way, and we are here for a virtual session talking all things STEM career pathways. So if you're interested in STEM, if you're just looking to see how do I see myself in the future pursuing career in these STEM industries, you're in for a treat because we have a special guest here who's going to introduce her work and herself and also provide some little nuggets as to how you can see yourself in the STEM industries. So I don't want to say too much about what we're going to dive into. We have our guest here and I want to introduce her. So please help me welcoming Zirah. Hi, Zirah.
Hi, everyone. Pleasure to meet you virtually, everyone, and thank you for having me.
We are so excited to have you, Zirah. Now, Zirah, I just want to kick things off here. So we are excited to have you. Let's learn a little bit more about where you're coming from and the company you work for. So please introduce us to your company and the work that you do.
Sure. So my name is Zirah, and I'm a clinical pharmacist in oncology. I work at a hospital named Massachusetts General Hospital, and I work with nursing and doctors to provide care for patients diagnosed with cancer. I am from
Awesome.
San Juan, Puerto Rico. So anyone that might know, it is a little island off the coast of Florida, south of Florida, but not too far from the mainland.
Wonderful. So students, I hope that you are in for a treat because we are going to talk all things pharmacy and oncology at Mass General Hospital. So Zira, I mean, let's move past this. I mean, Mass General Hospital is a really big name or brand. Lots of people are familiar with the hospital. So tell us, how did you find yourself kind of pursuing the STEM career? Did you always know that you were going to end up at a hospital like Mass General?
So I particularly didn't think that I was going to end up at Mass General, but I've always been intrigued by science and oncology. So I pursued a career in oncology because I completed a bachelor's in science, master's in public health, a pharmacy doctorate, all at the University of Puerto Rico, and then I completed a residency at Johns Hopkins Health System. So I always was involved in research, oncology, science, and pretty much health sciences. So trying to improve how we treat and manage diseases for patients. That led me to a position at Mass General. So it is one of the monolith because they're sort of one of the top hospitals in the nation where plenty of research is being conducted to improve and advance our field. So that's always exciting to be part of all that.
Yeah, thank you so much for sharing that. So, I mean, a lot of students who might be listening in, Zira, are really new or interested in the health sciences fields. So, can you tell us what makes your job unique or interesting?
So my job is unique because we handle chemotherapy. We manage, oversee, and verify drugs that have been in the market since they were discovered in the 1950s, chemotherapy, and they're drugs that are a little more novel and newly discovered recently in the market that kind of treat the body and the cancer in a different way, helping our immune system fight off the cancer. So I handle drugs on a daily basis that have different mechanisms of action, which is how they interact with the body to fight off the cancer. They're also drugs that have been derived from different marine environments or even animals such as rabbits, horses, mice. There's different drugs that have different specific traits. One is usually secreted through the sweat gland. So it's important to counsel patients on the importance or the need to shower regularly and change their bed sheets just to avoid toxicity. So that's a specific trait of certain different drugs that's important to keep in mind when you counsel patients. Then there's also fun, cool colors that drugs come in. There's a vibrant red, purple, blue, yellow, and even a milky white. So I get to see those while they're getting prepared, which is also fun and cool.
Very, very exciting. So, you get to see a little bit of everything. Thank you so much for sharing that. So, I mean, it's
Yeah.
really exciting to hear about, the focus that you have here in the health sciences industry. Zira, can you tell us a little bit more about the like environment that you work in? Is it more so like an office workplace, or do you find yourself more so in the lab or on the bedside dealing with patients? Can you share more about that?
So my work setting is at a hospital, specifically at a cancer center. So I do work at an office. We have Computers where we see the labs and the profile of a patient that's coming in for their infusion for their chemotherapy. But we also have the infusion center where we see the patients, we counsel them on the drugs that they'll be receiving before they start their treatment. So we counsel the patients on what to expect, what drugs they're going to receive, how frequent they're going to have them. So we prepare calendars for them. So it's a one on one interaction before they start their chemotherapy. And then throughout their infusions, we get to see them just to check in, make sure that they're all right, not experiencing any side effects. And we talk about if they are experiencing any side effects, how we could manage them, any medications that they need to take while they're on treatment just to support them. And so answer any questions that they or their family members might have. So it's a little bit of everything. It's a little bit about infusions with a one on one with the patient or the patient's family member, as well as being in an office to ensure that you're verifying the medications right, that their labs look good, and it's safe and effective for the patient.
Mhm, mhm.
So you have different settings, which is great. It's not the same every day.
Yeah, that's what I was going to say. It definitely speaks to the nature of the environment at a hospital. So thank you for highlighting that not only are you in the office, but you're getting that dynamic of social interactions and kind of individual work. Students, I hope you're listening closely because if you're looking for something like this, I believe you might be on the right path. So Zira, as we move forward, I want to kind of shift our focus here. We talked a lot about the work that you do, the environment that you work in, and the company that you work for. Understanding that the health sciences field is stereotypically leaning more towards a dominant culture that is representative more so of the white race or even the male kind of gender. Could you talk more about your identity in this space and whether or not you ignored it or celebrated it in that space?
Sure. It is prevalently male and white, but being a Latina provides skills, strengths, and differences. Diversity is important. And so I embrace it because diversity and differences helps us to provide new ways of thinking, new ways to approach new things. So it helps a group solve problems or manage things that we might not be doing as well in. So I see it as a toolbox. Every tool is used because it has different strengths, but if you're using them in conjunction, it helps you build something great. So every tool has its specific traits or specific strengths. So acknowledging and embracing that is always helpful.
Absolutely. Thank you. And I
Yeah.
understand, doing the work that you do is really important. There are oftentimes, difficult challenges. I know our students who are in the sciences are, testing different hypotheses or doing different things to kind of expand their learning. And what we kind of reinforce here in Boston is a growth mindset, understanding that mistakes are a part of the journey. Could you talk about a time where you were challenged or stuck or, kind of have to exercise your skills more intentionally? How did that kind of experience unfold for you? And what kind of advice would you give our students? So it's kind of a twofold question.
So there are times where you're going to encounter some challenges. So use that challenge as not a deterrent, but an opportunity for you to learn and grow from that situation. Use it to be the best that you can be and work hard so that you can prove that your work is meaningful and impactful. That way, it validates what you're doing. It serves as motivation to keep on going. And then it also helps you self-reflect on how well you're doing because you look back at all that you have endured or encountered, the challenges that you might face, but all that you've accomplished. At times, people might feel like I didn't have an education from a US school, so sometimes they might think that I don't know as much as others. But then that's the situation where you prove them wrong and that you are a valuable asset to your team and your healthcare workers, coworkers, patients, and patients' family members as well. It's important for you to do valuable work and show others that you are definitely there to help along the way.
No, absolutely, absolutely. I'm thinking about the toolbox idea that you shared, and how important it is to have diversity in these STEM industries. And I'm thinking about some of our students who are English language learners or just multilingual learners, and it's so exciting to hear
Yeah.
that somebody shares their identity. So I'm just curious, Zira, thinking about that population or the students that are really inspiring to kind of be in your or follow in your footsteps, what advice would you share for them? Understanding that there is a need for more diversity in the STEM fields.
Diversity is very important because representation does matter. I remember a time, one of my first jobs, one pharmacy technician with a similar Hispanic background said to me on my first day, "Wow, I've never seen a pharmacist's work here before."
Hmm,
And that was very inspiring because that served me to be the best that I could be and serve as an example and an inspiration for others that might be climbing up and be involved in the same career as I with the similar background. It's always helpful to have a different language. So my main language is Spanish, and that is definitely helpful because when I do encounter patients that are from a Latino background, I can talk to them in their same language. They see that I may understand where they're coming from or how they feel. And that way we engage in a better interaction that makes them feel more at ease. And I feel that that is the most impactful or meaningful work that you can do. Having that rapport with patients and feeling that they could come to you if they have any questions or concerns, or even if they just need help with something. That's always meaningful to me. So
absolutely. And
always use your other skills. Being a Latino is great. Latinos are caring, warm, social people that are always trying to engage with others. And even at work, sometimes I feel like I'm sort of very verbose, and coworkers do like that because I might be the positive outlook that they might be having a bad day, and I am there to support them as much as possible. So it's not only patients, it could also be coworkers.
yeah, thank you so much for highlighting that. Because again, it reinforces that environment that you shared with us earlier of just, not only is it an independent kind of work, but it's that social kind of collaborative work. And with collaborative work, there's a lot of emotion, and I love that you're sharing that empathy piece. So, students, I really hope that this resonated with you. Zira, thank you so much for taking the time to share your story. We're nearing the end of our session here, so I wanted to open up the opportunity to give you any space to kind of share last pieces of nuggets, advice, steps forward for our
Sure.
students who might be interested.
So I believe that work in STEM is very important because advancements in our fields are the way of the world. Because as everything in science, technology, engineering, math, it always starts with a question or how can we improve something? So having people more involved in trying to improve the things that we already know or we do at the moment is also a catapult to do greater things. Now, if you choose not to do field work in science or technology or any of the STEM fields, I always encourage you to do the best that you can, work as hard as you can, but aim high, no matter if you're a minority or if you are of a different culture that's not usually prevalent in these fields. It's important for us to be present because we do engage in great work and we do bring very good traits and skills to the work group. Use these platforms and technologies like these webs courses that can help you strengthen the skills that you have at the moment, but also help you on subjects that you might not feel so good at. And these could be opportunities for you to excel later on in life. Potentially, this web course can help you inspire others eventually in the long run as you move forward in the future.
Beautifully said. Zira, thank you so much again for taking the time to share your journey with us. Students, thank you for listening in, tuning in. I know that these STEM sessions are short, but super sweet. I wanted to mention that Zira is happy to connect with anyone who is interested to kind of talk more about, what it's like working in the oncology field, what it's like to pursue a career in Mass General. Sorry, my cat here. And just to kind of again build this community of understanding the importance of pursuing a STEM career. So thank you again to all of you for joining us, and special thanks to our guests here for joining us. I'll see you at the next one, and we are here at the end of our session.
It was a pleasure.
Bye now.